Afternoon, happy Earth Day. We're so excited to have a beautiful state, and we're so happy our clouds have now returned as we expect them. We've had this unbearable heat wave, of course, so now we're enjoying a beautiful Earth Day with a beautiful cloud covering. And we're always proud of Earth Day. We're particularly proud of our legacy of Earth Day. It was started, of course, one of the two co-founders was Washingtonian Dennis Hayes. Dennis, we appreciate his leadership. We had Bill Ruckelshaus, first director of the Environmental Protection Agency, Washingtonian, who led us in so many great natural causes. And now we are celebrating an opportunity to continue to protect our beautiful state. And we now have, for the first time in over a year now, an opportunity really to have increasing confidence in our ability to attack the existential threat of climate change to our state and our country and our planet. And that is in part because the Biden administration has announced quite a number of measures to attack climate change, most recently a bold national target to cut emissions by more than half in 2030. We love seeing the federal partner joining us in this regard. It's very consistent with what we've committed our state to do. And it is now such a joy to have a federal partner working with us. This ambition is leadership just when we need it. It is sorely needed, it is urgently needed. We know that falling short of this goal would be catastrophic. The most recent, some of the scientific assessments I've heard it described as we are on the abyss. We are on the edge of the abyss, and we've got to have immediate action. Catastrophe should not be acceptable to us in our state or in our nation. So we're very happy about these developments on the federal level. And we're very happy about the things we are doing locally to fight climate change and restore and protect our environment. This morning I toured the Ecos company in Lacey. What a cool company. This is a company that makes a whole host of products, cleaning products that are environmentally sound and manufactured in a way that reduces waste, reduces water pollution, and reduces carbon pollution. This is the only manufacturer in America that has won national awards for all three of these: to reduce waste, to reduce water usage, and reduce carbon pollution below acceptable levels. They have won the trifecta, the triple crown of environmental protection, and they're right here in Lacey, Washington. This is a woman and minority-owned business. It's also focused on diversity and empowerment. I got to meet their staff that have used innovation to keep everybody safe from COVID. At the same time, they're manufacturing products from natural ingredients. And to me, it was just a proof right here in Lacey that you can have a very robust, successful business. They have 4 manufacturing sites across the nation to produce earth-friendly products in a way that actually reduces carbon pollution at the same time. This shows economic growth goes hand in hand with environmental stewardship, and we're proud that they are here in Washington State. We're also seeing great things in our schools. Today, the U.S. Department of Education named Anderson Island Elementary a Green Ribbon School. It's an honor bestowed on institutions that have reduced environmental impact, reduced cost, and improved health, and has offered sustainable education. They've ambitiously and effectively incorporated the outdoors right in their classrooms. They've organized local cleanup efforts. They've restored creeks to health, and they're building an ecosystem one salmon at a time. They're educating their students and their staff on how to conserve energy. Between seeing business leadership and Ecos, which gives a bonus to their employees when they live close to work so they don't have to have transportation costs, to this school, good things are happening right here in the state of Washington. And we are excited about the prospect of the legislature joining these efforts by passing good, strong climate legislation this year. The legislators today are working on a clean fuel standard that will give consumers more choices, cleaner choices, a way to reduce air pollution in our Clean Fuel Standards bill. They're working on the Climate Commitment Act, which will make a commitment to reduce carbon emissions to fight climate change in the state of Washington. These will also, both of these, particularly the Climate Commitment Act, reduce air pollution in our overburdened in our communities. These are communities that have been swallowing way too much pollution, frequently low-income communities, communities of color, who've had to breathe and have their children breathe and have to suffer asthma as a result of this. And this bill will have the strongest protections, the first ability to prevent overburdened communities from having to breathe that material in the United States. We're very proud of this particular bill, and I'm happy that we'll also drive investment and create jobs in clean energy. So we know that doing nothing is not an action. I'm excited about the legislators' work in the forthcoming days. We wish them well. We know they're working really hard on these bills. If we can talk about our vaccine efforts for a moment. By the end of this week, if not today, we will have administered 5 million doses of COVID vaccine, 5 million doses in the state of Washington. More than half of our adult population has received at least one dose. And so we know that our vaccine strategy certainly is fully operational, but we do need people to come in and to get the vaccines. We're administering close to 60,000 doses a day in our state. And the good news is we have the capacity to do much, much more than that today, assuming we get more doses from the federal government. But obviously having confidence in the vaccine is important for people to come in and get the vaccine. So we need to, all of us, I think, need to help one another build confidence in the vaccine. And we need to, that's important for their lives, it's important for our lives, and it's important so we can get back to really normal days of work and school and play and sports and everything else that we value. We have heard, I'm sure you've heard people that have said, well, I'm kind of on the fence on this vaccine. Being on the fence is too dangerous a position right now. We still have 300,000 people over the age of 60 who have not received the vaccine, and these folks are at risk right now. And here we have a very safe vaccine. Over 90% of physicians have already got the vaccine. And I know if people ask their medical provider, their doctor, their physical therapist, their chiropractor, their dentist, they'll get some good advice, and I'm sure they'll be advised that this has been demonstrated as an extremely safe vaccine and is safe to use. So we hope people will talk, if they do have any questions about it, with their medical practitioners and just ask them a question. We're confident if people do that, we're going to have more people get the vaccine. Now, if you haven't gotten your vaccine, you can get your appointment. You can find it through our Department of Health, and that's at vaccinelocator.doh.wa.gov. It's on the screen, and we have a phone number there as well. And there are multiple languages available as well. Now, we have a situation we're dealing with right now. I wish it was otherwise. The situation is we'd like to be done with the virus, but the virus is not done with us. And that is demonstrated by the fact that we are seeing a potential wave. And I'm going to ask for the different graph to be put up here. No, there's another graph that shows the numbers. If you can put that up, please. I think we might have skipped that graph that I wanted to show. The other one showing the daily case counts. So unfortunately, we now are seeing the beginnings of a fourth surge in the state of Washington. This basically shows our case counts on this graph. And you'll see we've had 3 previous surges. We haven't been able to knock down those waves when they have hit us because we've been smart, we've made decisions based on science, we've worn masks, businesses have been responsible, and as a result, we've been able to knock these previous 3 waves down. Unfortunately, again, can we go back to the previous one you just had up? I wanted people to be able, there we go. Okay. I do want people to just look at this graph if you're interested, because we have a fourth wave developing on the right side of the screen. You'll see a relatively sharp increase, which also shows it's going up in age groups, particularly in younger folks. This is the beginning of a fourth wave, and we are starting, unfortunately, at a higher level than the other waves have started from. That's bad to start at a higher level, obviously. And we know that we're not as high as we have been in the third wave or even maybe the first wave, but we're heading in that direction. And that is simply too dangerous to persist. Now I'd like to show you our hospitalization data, if we can put the hospitalization graph up. Maybe I was showing the hospitalization graph. Okay, so we have our hospitalization are also rising in addition to the case counts. And this is dangerous, obviously, because this is not just on testing. These are really people going to the hospital. And these are going up as well, unfortunately, at a rather significant pace. We also have shown a distribution where younger people are now getting it. And their rates are rising faster than in the older population. This is very, very disturbing. Now, why is this happening? One of the significant reasons is we have new mutations of this virus, variants. These variants are, some of them, more transmittable and possibly more dangerous. And we believe that the presence and increase of the variants is one of the reasons we're seeing this spike. On the screen now, you've seen a graph, and basically what this shows is the distribution of the varieties of this virus. And what you'll see, the red is perhaps the most dangerous virus. This is B117, and this shows the scale moving to the present on the right side. You'll see the red is increasing as time has gone on. And two other varieties you'll see in the blue and the purple are two other varieties. These are now well over 50%. These varieties, these new mutations, are now well over 50% of the total load of our virus. This is bad news for us because these are more transmittable. Each person with the same disease can transmit it more easily. And the science is highly suggestive that this is a significant reason why this virus is now increasing in our state. So we have to be extremely adept at attacking this virus, not just by increasing the folks who get the vaccine, but by continuing to mask up, to socially distance, to keep our get-togethers small, and importantly, to take it outside. Because we know when we take our operations outside, they're much, much safer because we don't have confined air circulation. So we're encouraging people to do that in all the circumstances we possibly can. As I noted, hospitalization rates are also going up significantly in our 20 to 59-year-olds, even faster than our older groups. This is extremely concerning, and here's why. As we know, a higher percentage of our fatalities have been in the older Washingtonians, but we are now finding an increasing number of people, 20, 30, 40-year-olds, in the hospital with very significant illness, sometimes very prolonged illnesses for months. And so this is of increasing concern for the younger folks in our community, both from the perspective of reducing the transmission, because these are folks who are out and about, but also just to protect themselves, because these variants are now biting the younger population big time. So all of us at every age have an interest in getting the vaccine, and all of us at every age ought to have an interest to wear a mask and be careful as we go about. So we just want folks to be alert to that, what we face right now. Now, to talk about the course of this pandemic, and also I hope they'll make some comments about the safety of the vaccine, I'm joined by Dr. Dave Carlson, Chief Physician Officer at Multicare Health System in Pierce County, and Dr. Dan Getz, Chief Medical Officer for Providence Sacred Heart Medical Center and Holy Family Hospital in Spokane. We also have Lacey Fehrenbach here to answer questions. Dr. Carlson, thanks for joining us. Looking forward to your comments.
Thank you, Governor. I can describe our situation in Multicare. It's clear that we are seeing some rise in cases in the community and a slow increase in the number of patients who are hospitalized. It is not as, the spike is not as fast as we've seen in other waves, and I think that is largely because of mitigation efforts and primarily because of vaccination of the most vulnerable population, particularly the elderly, throughout the hospitalization. It's clear that, as you stated, our hospitalizations are being driven by a younger cohort, between ages, 20 and 60. and largely those with comorbidities. So diabetes, obesity, lung disease, but there are differences in how we care for them. So we're seeing less ICU hospitalizations, less intubations, and quicker recovery a little bit, and notably a bit easier discharges because they're younger and healthier to begin with, even though they may have, longer-term effects of the disease process. We've seen a few breakthrough cases, but to my knowledge, we've not seen those in our hospitals, so that's good news. The vaccines are working. And I think, if I could reassure our communities, at the current time, Multicare is well prepared to manage the safety and the people that need care in our community, and both those with COVID and those without. And in the early waves, we saw people delay care, and we saw harm as a result of that. We're not seeing that at this present time, and I would encourage people who have problems, medical problems, please, please come and see us. So we are prepared to meet the growing need of our population, and if we need to change or adjust how we're doing things in our hospitals, we're prepared to do that with the protocols we put in place in combination with all of the other hospitals in the state, and we continue to work on that. Our modeling that we do internally, we watch that carefully so that if we do see a place where we need to adjust our hospital operations and increase capacity, that we're prepared ahead of time to do that and not reacting to a bad situation. In regard to vaccines, I think that is the one thing that we can do to help this. And the reason we're not seeing the effects that we've had before is because of the rate of vaccine of that population that already has been eligible. That has made an unbelievable difference. And if we continue to rapidly vaccinate this younger population that is now at higher risk, we will have significant impact on the disease and the burden that's placed on our communities. And in fact, we'll get to open up and go back to a more normal state much faster. It's incredibly important that we continue the efforts of masking and social distancing and great hygiene, and to follow the protocols that are in place. That will help us as well. And addressing vaccine hesitancy. So this is very striking to me. In our population at Multicare, we're hovering between 55 and 60% of our workforce being vaccinated, and it appears that the demographic that is hesitant to get vaccine in Multicare is exactly the demographic that is hesitant to get it in the community. So non-Hispanic whites are vaccinated at a high rate, the minority population's at a low rate. This is really critical that we address it, and that we have strategies in partnership with our community, which we're working on very, very much to address vaccine hesitancy in high-risk groups and in groups that have far less trust in our systems and our hospitals and our leadership, so that they're reluctant to get the vaccine. So I think that's the job at hand, and we look forward to partnering with our health department, with our governor, and with all of our local partners to increase vaccination rates and particularly target those who are vulnerable and hesitant.